Good evening, everybody, and welcome to tonight's class on headaches. So let's first and foremost talk about why this topic is so important to me. Well, many of you know my wife, Crystal, who is in the office from time to time, and she is a severe migraine sufferer. So when we talk about headaches, it is a general term meaning pain in the head, right? Sorry. Cephalic pain is where my head was going, and that's why I stopped. So cephalic meaning head. So when we have pain in the head, it can be multitude of different things. Yes, it can be a general headache. It can be a sinus headache. It can be a tension headache. It can be a cluster headache. It can be a migraine. It can be a whole bunch of different things, right? So we use headache as a general term. So never feel bad if a doctor doesn't call your migraine a migraine and refers to it as headache. It's using it in a general term, okay? Now, if they are a migraine specialist, well then, yeah, they probably would just refer to it as a migraine. But they may be referring it to an ocular migraine or migraine substantia nigra or any number of different things, right? So there's so many different classifications. In fact, I'm kind of curious about this, so we're going to try and look this up online. And this just popped into my head, so I apologize. If we look online and we pull up how many different diagnoses there are in the DSM, which is the Diagnosis Service Manual. Let's see here. So there's several, right? Yeah, so I mean, if you were to search this, you're looking at so many different ones, and I apologize, I'm not good at doing two things at once. Just ask Crystal, she knows I suck at that, right? So looking over here, what I see is migraine, which is a G43 code, or a tension type headache, which is G44.2, or a cluster headache, which is G44. But if we pull up, like with Chirotouch, right, which is our service manual that we use here, which is our EHR, our electronic health records. We pull that up and we put in G44, and I'll do that once this pulls up. It's going to give us the vast majority of different things for all the different possibilities with headaches, okay? So I'm going to pull up a patient file, and obviously you can't see this. And I'm going to go to their diagnoses. And sorry, this is taking a little bit longer, so I apologize. So if we go to somebody's diagnoses here, and clinical, there we go. So if I go into here and I search diagnoses and I put in that G44, okay? So what's interesting is there's G44 cluster headache unknown or unspecified intractable. Then there's not intractable. Then there's episodic cluster. Then there's chronic cluster, both the intractable or non-intractable. Then there's episodic proximal or paroxysmal. There's just so many different things for the G44, right? If we look at all of these different types of diagnoses, it is insane how many of these are actually related to headaches in here. It's got to be somewhere in the 20s or 30s different types of headaches that you would actually diagnose, right? It's insane. Absolutely insane. So keep that in mind. And like even just a headache, just like the 44, if I go all the way to the last page, which is page 4 of these, and there's what, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So that's over 40 different types of headaches that you can actually put as a diagnosis. So headache is a general term. Now that doesn't include none of those, okay? 0 of those included migraine. So if I search diagnosis for migraine, I have 10. So that's 40, 1, 2, 3, 4, 5, 6, 7, 47, or excuse me, yeah, 47, nearly 50 that are just migraine related. So we're talking over 80 different types. So when your doctor mentions about headache, he's using it as or she is using it as a general term, not to discount in any way, shape, or form yours. In fact, the vast majority of migraines or headaches, general headaches that I see, are typically cervicogenic in nature, meaning they actually come from the tension in the muscles of the neck, pulling on the base of the skull, causing all of the muscles through the skull to contract, causing a headache. Okay. Now, there's a ton of different issues with migraines that are very, very different. For instance, migraines typically, most commonly, will have an aura. And now, what is that aura? Well, it's different for a lot of people. Sometimes it'll be these little sparkles that they'll see in their vision. Sometimes it'll be extra static that they'll see in their vision. Sometimes it'll be kind of a closing in of vision, going almost to like tunnel vision. Sometimes it'll be colors that they'll see. Sometimes it's just a feeling of impending doom. Sometimes it is pressure. Sometimes it is that they get flush. I mean, there's so many different things that could be considered an aura. Okay, so again, there's so many different variations. So why am I talking about all these different variations with chiropractic? Well, chiropractic works with your nervous system, right? We help to take pressure off the nerves so that your brain and body can communicate the best way it can. So when that happens, the chances of your headaches getting better are high, but not always. Okay, and sometimes with migraines it won't, and sometimes it will. Take people that have ocular migraines. Well, if you're talking about the ocular system, that is contained completely within the head. So how could a chiropractic adjustment help with that? Well, what's interesting is C1 and C2, primarily C1, surrounds the base of the brainstem, which is where the nerve cell bodies are located for some of the ocular realm of your head. So, and trigeminal, which goes into the face, right? So a lot of different things are kind of within that area. And so adjusting C1, and it's called Atlas because it holds your world on its shoulders. And by your world, I mean your brain, right? By adjusting that, we can see a lot of results with things that are cranial in nature, as well as doctors like myself that have taken extra time to learn certain cranial techniques where we can actually help to get the skull, the plates of the skull, whether it be the parietal, the occipital, what have you, to get those to start moving a little bit and get those better aligned and remove those subluxations. And it's amazing what happens. Yes, much more common to do that with infants and children than it is to do that with adults. But let me tell you, I've had great success with patient outcomes using cranial work on patients with traumatic brain injury, chronic migraines, chronic tension headaches, chronic cluster headaches, cognitive impairments, tons of stuff. I've seen great results with that. Does that guarantee results for you? No. Right? Any doctor that says, I guarantee this is going to give you great results, is blowing smoke. We can't guarantee it. And it is definitely not a cure-all by any means. Nothing is. Okay? And if we take pressure off of a nerve, by that common sense thinking, you will inherently be better off for it. So if you're wondering how we can help you, give me a call, right? There's lots of different ways. I know you know somebody out there that suffers with migraines, headaches, what have you, all the time. And stress does not help it. And that's why next week's class is on dealing with stress. It's called Attitudes to Gratitudes. Because stress causes headaches. And I want you guys to be feeling and functioning better. So those friends of yours that you know that suffer from chronic headaches, chronic migraines, get their heinies in here. Get them to get in here. It's amazing how much better we can do when we're not fighting pain and pressure and other symptoms that are keeping us from having a functional life. Look at my wife, okay? She used to have between 7+ headaches or migraines, debilitating migraines every week. So that means in a month, she may have 1 or 2 days where she doesn't have a migraine. And some days she's having more than one migraine, right? She'll have a migraine really bad when she wakes up, and then, she'll take rescue medications and it would go away. And then later on that day, she'd get another one that just socks her right to the ground, right? That's no way to live. Well, under chiropractic care, we were able to reduce her frequency of 7+ migraines in a week to 3 or so a month. Think about that. Instead of going from 1, maybe 2 days in a month without a migraine to having 2, maybe 3 days a month with a migraine, how much do you think that her life had changed? Right? Then we started delving into, why are you still getting them? And we realized that it was actually a seizure trigger. Okay? And guess what, guys? I, as a chiropractor, referred her to a medical doctor for medical treatment. Right? Why? Well, because chiropractic needs to work with medicine, and medicine needs to work with chiropractic. Okay? And it's amazing what happens when we do. Because yes, he confirmed you're having ocular seizures. And that's what's causing these. And we got her migraines down to 1 every 6 weeks or so. 1. I mean, that's fantastic. And the severity of those migraines, she only has maybe 2 or 3, maybe 4, if it's a bad year, that are debilitating. The vast majority are not. And sometimes if we see her aura, which is a visual aura that I can see, and that she can see, and everybody else can see, if we can see it and correct it soon, she doesn't have one. And it's amazing. It's really cool. So again, refer those friends and families, right? Those friends and family members that are having these problems. So it's really cool to see how things can change and how their function can improve and how much better they can do. So if you're wondering how to do that, get in contact with us below. You can leave a comment. You can go onto Facebook, onto this, where we're at here, and contact us through there, message us through there. You can call us. Our number is 231-498-2128. Again, that's 231-498-2128. Give us a call. We'll set up a new patient appointment for you or for your friend or for your family member, and we'll see how we can help them achieve a much better functional life. Alrighty? With that, I bid you a very, very good night and a very happy Thanksgiving. Next week, normal hours, but this week, we're only open tomorrow. And we're closed Thursday through Sunday to be with our family, as I hope you are. So I wish you a very happy Thanksgiving, and I look forward to seeing all of you tomorrow or next week. Thank you very much, and good night.